As the lung navigator at Centegra, I'm responsible for your care from the moment you contact our program. I also alleviate any barriers there is in pulmonary nodule screening and management. There's a stigma about lung cancer. Patients are usually much harder on themselves than anybody else would be on them. Your physician doesn't necessarily think you have lung cancer just because he ordered a lung cancer screening. You just meet the criteria for a lung cancer screening. There is 3 criteria for eligibility for a low-dose CT for lung cancer screening. The first one is 55 to 77-year-old. The second one is a 30-pack year. So if you smoked 1 pack a day for 30 years, that'd be 30-pack year, or 2 packs a day for 15 years, that'd be 30-pack year. And the third one is current smoker or a former smoker that you quit within the last 15 years. Most people do have lung nodules. Over 95% of lung nodules are benign. They are not cancer. They are infection or inflammation or scar tissue. If lung cancer is found on screenings, patients have a much better outcome. The physician or the provider of the patient will call the patient, discuss the results and if further workup needs. I also do call the patient and answer any questions they may have. And we also do send a letter from our program to the person who wrote the order and to the patient. We have an interventional radiologist that can do a needle biopsy. We have a pulmonologist that can do a bronchoscopy. We also have a cardiothoracic surgeon that can consult the patient for surgical options. We have a lung conference where all the suspicious nodules are presented. In attendance of the lung conference are a radiologist, oncologist, a pulmonologist, and a cardiothoracic surgeon. The nodules are presented and treatment options are decided. Smoking places you at a higher risk for lung cancer. For individuals that smoke, that places you at a 20 times higher risk for lung cancer than non-smokers. Screening is not a reason to continue smoking. The number one thing you can do for your health is to stop smoking.